Hi, my name is Sierra Rogers, and I just want to go ahead and I want to thank you for accepting me to the second round of this internship application. So for the first interview question, I'm going to go ahead and I'm going to tell you about a time when I had to use the nursing process in my clinical experience in order to fix a problem. So this happened on my med-surg floor when I was giving a patient a bed bath. And I was also doing my assessment. I ended up seeing some redness and some skin deterioration on his lower back, and I had recalled from the earlier notes that someone had already documented that there was some redness, but this had clearly progressed further into a pressure ulcer. And so I got my clinical instructor, we further assessed this, and we decided that it was a stage 3 pressure ulcer. Our plan of action was that we went ahead and we called the wound nurse. The wound nurse came, had me help assist to clean this. We cleaned the wound with some normal saline, and then we put a hydrocolloid Band-Aid on it. We then evaluated what we did. We did all the correct steps for this situation, but someone along the way did make a mistake and overlooked for a couple days that this pressure ulcer was further deteriorating and causing more pain for the patient, so we ended up having to fill out an incident report. We then decided that for our further plan of action was that we were going to go ahead and we were going to assess the wound twice daily, and we were going to clean the wound once a day, and then we would rotate the patient every 2 hours. So for the second interview question, I'm going to go ahead, I'm going to tell you about a time when I was in a situation that didn't go the way I expected, but I went ahead and I adapted to the situation. So this happened on my OB floor. I was changed patient assignments kind of at the last minute, and I went ahead and I went into my patient's room, and my patient was having her baby, or she was about to, and she had progressed a lot further than anyone had really expected, and so nothing was really set up yet, and the doctor had just gotten in the room, and the baby was crowning, and so it was kind of a really intense, high stress situation at the moment, but everybody got ready as quick as they could. Doctor had me tie his gown really quickly, and baby came out, and he asked, he needed a towel, so I grabbed a towel, he put baby in my hands, and then we gave baby to mom, and everything was perfectly fine. But this was a good situation in which the chain of events, kind of like something unexpected occurred, and I really was able to work and adapt with the other healthcare workers in order to fix the situation, and everything ended up perfectly fine. So for the third interview question, I'm going to go ahead and I'm going to tell you an example of a time when I successfully communicated with someone who had a different communication style than me. So for this example, I'm going to go ahead and use an example of when I was working reception at Dartmouth in the X-ray department. I had a volunteer, I was sitting at my desk, a volunteer was bringing a patient down the hallway. Patient was very distressed, was swearing, was yelling. So I went out, met the patient out in the hallway, and I kind of was like, hey, let's have a conversation. What's going on? Let's talk. Like, I'm here to help you, but I can't have you come into my waiting room when there are families and children in there and they can't listen to the language that you are trying to use right now. So I really got down on his level. We had a conversation. I told him I was there for him and that I was really sorry for what he was going through, but that we were going to work in this together and we were going to take care of the situation. And he really calmed down a lot. I was able to bring him back up to the reception, and we checked him in, and he got his x-rays, and everything went smoothly as it could. All right, well, thank you for giving me this opportunity to answer these questions.